So for our presentation, my group and I decided to pick chlamydia, which is the most commonly sexually transmitted disease in the US. First, we're going to begin talking about the organs that are affected by chlamydia, or more specifically, the reproductive system. The reproductive system can be defined as a group of sex organs that work together within an organism for the mutual goal of sexual reproduction. Besides organs, there is a lot of other substances that play a role in the reproductive system, like hormones, fluids, and pheromones. In this picture, I'm showing the difference between the female and the male reproductive system. If you look closer, you can see that the red highlighted areas are the areas that are mostly affected by chlamydia. Now we're going to dive in deeper about the organs affected by chlamydia, and we're going to begin talking about the female specifically. So as you can see here, we have the vagina, cervix, urethra, anus, eye, and throat. Now we're going to look at this picture over here, and if you can see on the left side, we have a clear fallopian tube with no chlamydia in it. So the egg is easily able to go from the ovary to the uterus. Now if you look on the right side, we have a chlamydia infection in the fallopian tube. Now this chlamydia can lead to a buildup of scarring tissue, and it can block the fallopian tube in general, and which leads to infertility. As a matter of fact, chlamydia leads to 1 in 5 of infertility is due to chlamydia. Additionally, the blocking of this fallopian tube can lead to pelvic inflammatory disease. So it's very important that we always get tested and treated as soon as possible for STDs like chlamydia. Now we're going to talk about the organs affected by chlamydia, specifically the male. We have the penis, urethra, anus, eye, and throat. In general, chlamydia can lead to urethral infections in men and more commonly swollen or tender testicles. Now we're going to talk about the tests that are used for diagnosing chlamydia. We have either a urine test or a swabbing. The urine test, basically a patient will just pee into a cup, and that cup will be sent over to a laboratory, and that lab tech will look it over and look at the sample under a microscope and see if the bacteria matches that of chlamydia. Now for swabbing, this can be done for men or women, but we're just going to talk about women in this situation. So, a doctor will take a swab of discharge from a woman's cervix, and that will be sent over to a lab, and then either a culture or an antigen testing can be done to figure out if that is positive for chlamydia or not. This can also be done during a normal pap smear if necessary. Okay, now we're going to talk about risk factors that can lead to someone becoming infected with chlamydia. First, we have an obvious one: vaginal, anal, or oral sex with someone who has chlamydia. Basically, whether it's protected or unprotected, if you have sex with someone who has chlamydia, you are at a chance of also getting chlamydia. Now, a less known case is from a mom to a baby. If a mother is pregnant and also has chlamydia during her pregnancy, and it's not treated before giving birth, this can lead to the baby also, 50% chance of the baby catching chlamydia additionally. Also, if a mother has chlamydia while she is pregnant, this can lead to a preterm baby or many other travesties like that. Okay, so now we're going to talk about a myth that many people may believe is true, but is not, and that would be you can't catch chlamydia through oral or anal sex because they are safe. Now, many may believe this is true, but as a matter of fact, this is false. No matter if it's oral or anal sex, if you have sex with someone who has chlamydia, you're at a chance of also getting chlamydia. That's why it's very important to always use protection and to always get tested and treated as soon as possible. And always make sure you know the background before having sex with an individual. And this is also true with any other STD. That's why it's very important to get tested and treated. Thank you.